Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Today we're going to do an examination of the teeth. For purposes of this demonstration, we will assume that the following records have been filled out and completed. Health questionnaire, form number 3A. The history of the patient, number 3B, and the clinical examination, that is the head and neck examination and soft tissue examination of the head and neck and in the oral cavity. And the following radiographic form, number 3D, is one we will use today, as well as the number 9B, A and B, the operative dentistry clinic worksheet and treatment plan. First, we'll look at the x-rays, the full mouth x-rays and posterior bite wings, and make an evaluation of those radiographs. Form number 3D, radiographs, under periapical films, shows the following items which we should look for when we follow around the periapical radiographs. Number 1, lamina dura. Check the continuity and thickness of the alveolar crest area, the lateral aspect, and the apex. Number 2, the periodontal space and bifurcation. Number 3, position of alveolar crest. 4, root form. 5, periapical change. 6, developmental and environmental defects of teeth. 7, pathologic change in jaws. Number 8, calculus. Number 9, carious lesions, we will record on form 9A, 9B. Now let's look at the radiographs themselves. Here in the upper right quadrant, tooth number 1 is missing. You can see the alveolar crest at this point is heavy. It comes over to tooth number 2, which shows some gross loss of tooth structure. Exactly what this is, it cannot be determined on this radiograph. Number 3 shows a large restoration, but it is impossible to distinguish any carious lesions on this radiograph. If we go to the second radiograph, we still cannot determine any caries in this area. We can check root form, check lamina dura. It is not easily distinguished in some cases, but we can follow around and see that it is very distinct. You can see lamina dura, periodontal membrane here in tooth number 5, 6, very clearly. Root form is good, and we will continue to the next film. Number 6 is shown here. Apex is good. Lamina dura, periodontal membrane. Number 7 shows a small radiopaque area right there. And you will determine what that is when we look in the mouth. In the same manner, we will continue to examine the periapical x-rays entirely all the way around over to tooth number 32. After completing that examination of the radiographs, we will make the necessary recording on the radiographic form, as you can see here. Now if we look at the posterior bite wings, we will see, again, we're going to check the position of the alveolar crest, defects and restorations, pulp size and shape, coronal shape, calculus, and eventually we'll do the carious lesions. If we look at the radiograph of the right side, we will again be checking for alveolar crest. You can see between number 4 and 5, it's a little high, a little bit more space between the CE junction and the alveolar crest. The alveolar crest itself is thick and continuous, and it looks good in that area. And we will continue to examine the teeth in the posterior bite wings to check the items mentioned. After we have completed filling out this form number 3D, we will look at number 9A, 9B, and begin to fill out this form in the posterior bite wing column. And in the posterior bite wings, we will begin with tooth number 2. We know that there's some loss of tooth structure on numbers 1, 5, and 2, surfaces 1, 5, and 2 on this tooth. And we will have the patient make a record as we progress on this 9A, 9B. Tooth number 3, we can see a small mesial and distal carious lesion. If we continue, we'll see 4-1 and a very small 4-2. Number 5-2 is quite evident, but the patient informs us this carious lesion has been present in this condition for at least 5 years. So whether we do this restoration or not depends on the history of the case. We can verify the findings here by looking at the other smaller film, the number 3 size. And they do coincide. As you know, the posterior bite wings are made, they are exposed for the purpose of finding carious lesions. The periapical radiographs are made for the purpose of examining the entire root form and condition around the apex, condition of the bone around the teeth. If we continue here, tooth number 12, too, has a small carious lesion, again incipient, and one we will observe. 13-2 is the same. Here on number 14, we have a good restoration, a little heavy on the contour at the cervical. A cement base is evident because it is a slightly lighter situation than the metal restoration. It is a little more radiolucent. Another restoration on 15. 16 and 17 show a rather crowded condition. The height of the alveolar bone is evidently coming up right through the center of number 17. This looks crowded. 18 shows a restoration, and number 19, a little heavy here on the distal cervical margin, also slightly on the mesial cervical. Number 20, surface 2, shows a carious lesion, which is through the enamel. It is evident in the dentin. And this is a situation where we would do the restoration. All these can be verified with the additional film, which is located here. If we continue with 28, it looks normal. 29 shows a radiolucent area here in the distal number 29. And this is not located in the normal position for an interproximal carious lesion. It is slightly lower. And I suspect that it is a cervical caries, either buccal, interproximal, or lingual. Number 30 shows a restoration, as does number 31. And if we look at the film above and look back and forth to see if you can pick up the carious lesions, there is a carious lesion on 30 surface 1, 30 surface 2, and 31-1. Now we can enter these on the posterior bite wing findings, or rather, we can confirm them and see that the patient has done a correct recording job. It can be seen that the patient has filled out the form under posterior bite wings correctly. The student must be specific in stating what he wants on this record, if it's 152 or a 1-2, and what tooth it is in regard to should be mentioned, like number 12, surface 2, and the patient will make that record. If he wants to record an overhang, he should say 1912 OH to indicate overhang. In this case, we have number 29 with a question mark. In order to record the carious findings on the complete mouth or radiographic findings, we should look at the anterior region. The distal of number 6 in particular, which is difficult to see sometimes in the posterior bite wings, can be seen very clearly here. And we will follow along and look at the interproximal areas of the anterior teeth, including the lower anteriors. In this case, all these teeth appear to be clear of carious lesions. At this point, we can refer to the patient and do an examination of the teeth themselves. We will start the examination in the upper right quadrant. The first thing to do would be to check one surface of the tooth number 2, the buccal surface, continue to the occlusal surface, and here we can see that the restoration in tooth number 2 is a composite with a breakdown through the occlusal and over to the lingual surface. Now make a check with the explorer to see if there are any other carious areas or breaks in the region. There is a discrepancy on the mesiolingual cervical. Tooth number 3 shows a large amalgam restoration. Again, we'll come to the buccal. Check the buccal surface. Continue again with the occlusal. And we can see here that the mesial marginal ridge is broken down above the carious area. Now the lingual seems to be intact. At this time, we're simply recording findings. We'll make our treatment plan later. Now, to the occlusal surface of tooth number 4. Very often we'll need a little air to clear moisture and saliva to give us better visibility. After we've done that, we can come into the occlusal surface and check with the explorer, either number 3 or the fine number 1. In the case of number 4, it appears to be some stain, but no break in the occlusal groove. Tooth number 5 does show a catch in this distal occlusal pit. The explorer tine will spring away and has a very definite catch. As we continue now, we can examine the labial surfaces of the anterior teeth, and in the mirror we can examine the lingual surfaces. We note the form of tooth number 7 on the lingual side. Let's dry that with a little air. Here we see the heavy cingulum. This is the radiopaque area that appeared on the periapical film. Also a heavy cingulum on tooth number 10. Here on tooth number 12 we have some more occlusal grooves to check. The stain is present, but don't be deceived by thinking that all stained grooves are carious lesions. They are not. You must catch with the explorer, and there should be some breakdown of tooth structure, some hypoplastic, or some loss of enamel. Number 14 has a large amalgam restoration, which appears to be acceptable. It has a rounded out anatomy but otherwise appears to be successful. If we check the mesial cervical, there is a slight excess. Coming up on the restoration, the explorer stops. It catches on that slight excess. That could be removed with number 12B scalpel. Number 15 and 16 look good. Now let's check the mandibular teeth. Number 17 shows a good deal of inflammation of the gingiva around the coronal portion, of pericoronal inflammation around tooth number 17. The amalgam margins on 18, the occlusal margins need to be checked. There's some catch of the explorer, but insufficient to warrant replacement of that amalgam restoration. If you recall, there was some excess, some overhang on tooth number 19, both mesial and distal. This is a porcelain on gold crown where there has been some loss of porcelain here on the occlusal. It was probably removed during the adjustments for occlusion. That would be a very difficult excess to remove and probably practically impossible. As we continue, we'll be checking labial, buccal, occlusal, and lingual surfaces as we continue around. Make a deliberate effort to look at all three surfaces. Don't look straight down, but move your head from one side of the patient, maybe get back over to the 1 o'clock position on the other side of the patient so that you can look down on the buccal surfaces of the lower left quadrant, and then back. The operator would move back to perhaps 10 o'clock so he could see the lingual surfaces. Also use the mirror. And we continue around the lower anteriors. Now to the lower right quadrant. Let's look at tooth number 28. We'll check labial and occlusal and lingual as we go around. Number 29 had a question mark, and if we check the labial, we find it right here on the labial cervical. A break in the enamel, and it should be restored. So that resolves that question. We can look at the occlusal and the lingual as we go. Number 30 has an amalgam restoration. All margins should be checked to see if they're intact and in good condition. The radiographs showed carious lesions between 30 surface 1 and between 30 and 31. We can check with an explorer, but if those carious lesions are in a rather small state, it's not easy to catch those with the explorer, and therefore you shouldn't rule them out by any means if you can't find them with your explorer. Now, as we continue, number 32 shows the gingiva is around that tooth, about halfway. Half the tooth is covered by gingival tissue, but there does not appear to be any irritation present. Now we can complete the form. We'll check and see if the patient has filled the form correctly. Now, if we refer back to the clinic worksheet and treatment plan, you will see that the patient has filled out the oral findings column. And now the student will make a summary, a summation of the findings in the posterior bite wings, the periapical radiographs, and the oral findings. And this summary will be listed as to surfaces involved. For number 2, it will be a 152. For number 4, it will be a 152. The occlusal was observed, but because we have a mesial and distal cavity, we must include the occlusal and make an MOD restoration. Here for number 12, the entire surfaces, number 2 and 5, will be observed. Now if we look at the tentative treatment plan, which is listed in numerical order from 1 through 32, we make decisions on what type of restoration will be placed. For number 2, a 3/4 crown, gold, indirect, is indicated. And we do continue and make decisions as to what surfaces are involved and what material will be used to do the restoration throughout the treatment plan. Number 12 is observe. Number 29-3 will be done with gold foil. After this tentative treatment plan is established, the student should call an instructor. He will check through the entire series of findings, the radiographic findings, oral findings in the mouth, and either agree with your treatment plan or make suggestions or alterations to this treatment plan. When that is completed, the instructor will sign across this column, and you are free to make your final treatment plan entries. The final treatment plan is entered as to the order in which you will do these restorations. And so a further decision is made as to which restoration will be done first. In this case, perhaps we will do number 2 first. The tooth and major surfaces is in the first 3 columns. Tooth number 2, it has no mesial or distal major surface, so a 0 is entered. The 3/4 crown is number 137, and then the fee estimate is checked in your clinic procedure manual. Second restoration might be tooth number 30, and number 30 has no major surface, no mesial or distal major surface. That will be procedure code number 136. And perhaps the third restoration will be number 31, an MO. The major surface is mesial. And the code for that would be 132. And the process is continued throughout the list of restorations. Observe areas should be listed at the end of the treatment plan. Now the instructor will sign at the bottom right of the page after all entries have been made. And the treatment plan is complete. The yellow page is retained with the record, and the duplicate, or the 9B, is turned into the records room.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.